representation. Now, former President Uhuru Kenyatta has challenged African leaders to find ways of funding the healthcare system instead of relying on foreign aid. Uhuru noted with some concern how some countries are spending more money on buying weapons instead of prioritizing issues affecting their own citizens. He said the American government has the right to freeze foreign aid to Africa. NTV's Kevin Mutai reports from Mombasa.
Retired President Uhuru Kenyatta's challenge to the African leaders comes against the backdrop of the suspension of foreign aid from the United States government to poor countries. This also follows frustrations expressed by the Kenyan government being among the countries hit by the directive, as it seeks ways of cushioning Kenyans affected by the freeze, especially those dependent on the US aid funding for diseases such as HIV, tuberculosis, and even malaria, among others.
I saw some people the other day crying, oh, I don't know, Trump has removed money. He said he's not giving us any more money. Watu wanalia. Why are you crying? It's not your government, it's not your country. He has no reason to give you anything. I mean, you don't pay taxes in America. He is appealing to his people. Shauri yenu bana.
Kenyatta asking African states to generate their own resources and use them prudently.
This is a wake-up call for you to say, okay, what are we going to do to help ourselves? Instead of crying, to jiulize, what are we going to do? Haya ametoa hiyo pesa, sasa tutafanya namna gani jameni? What are we going to do? Yeah? To support ourselves. Because nobody is going to continue holding out a hand there to give you. It is time for us to use our resources for the right things. We are the ones who are using them for the wrong things.
The Ministry of Health now says several interventions have already been rolled out to mitigate the shocks on the programs funded by the US government, asking the Treasury to restructure its budget to facilitate medication for the affected persons.
That calls for us now to reallocate some of the funds to the programs that are very important and crucial and were being supported by this by the US government. Those people who are on ARVs must continue receiving their ARVs.
The inaugural health summit in Mombasa now sets stage for strategic partnerships to enhance preparedness and response to health threats in the continent, including bioterrorism and biosecurity, aiming at strengthening global health infrastructure. The Africa Center for Disease Control also wants the region to manufacture its own vaccines to respond to pandemics.
This summit is also going to provide opportunity to revisit the agenda around local manufacturing for air security commodities, talking of vaccines, talking of diagnostics, talking of therapeutics.
So it's critical to strategically think about ways of mobilizing resources, securing resources to make sure that our health challenges are addressed.
With calls for regional collaboration in health security between the member states also dominating.
Kenya being the big brother of Africa, we are looking to be pioneers in UHC and again be best practice in Africa and beyond in matters affordable, accessible, quality care through the Taifa Care.
As part of this global healthcare security is continuing on that quest to partner with government, to partner with other agencies, to provide these solutions everywhere they need to be, especially across this Eastern Bloc.
Health and policy experts are calling upon the East African member states to embrace partnerships in tackling pandemic outbreaks through adequate response mechanisms, which will in the long run ensure a resilient health system across the region. Kevin Mutai, NTV in Mombasa.